There's an increasing number of cancer incidents worldwide and even in the Philippines.
Liquid biopsy was used in cancer patients for therapy management purposes, for monitoring the disease.
But that's the change in cancer care. Here it's possible to learn very early on if it goes from a negative to a positive. That's the promise of liquid biopsies in this form in a TrueCheck.
In recent years, we've made significant progress in cancer research. In fact, we can identify possible cancer cells through a simple blood test called liquid biopsy. It allows doctors to detect cancer long before symptoms appear. On the program today, we'll learn more about liquid biopsy, a technology that brings us a step closer in understanding and treating cancer. I'm Dr. Freddy Gomez, and welcome to MedTalk Health Talk. According to the Department of Health, cancer is the third leading cause of death here in the Philippines. And our best chance of fighting cancer is early detection and proper treatment. Now, to help us learn more about this, let's welcome to the program Dr. Rex Gloria, who is a lifespan physician. Hello and welcome to the program, Doc Rex.
Thank you, Doc.
When it comes to the Filipinos' attitude towards cancer or health in general, ang typical Pinoy, Doc Rex, pumupunta lang sa doktor or they seek health consultation pag merong nararamdaman, pag may simptomas. Even if they feel that there is something wrong, they're a little bit hesitant because they might be anxious of what they might learn. They might learn something that they don't want to be there. Talk to us about this. Ganito ba dapat talaga?
Well, I think it's brought about by certain cultural conditioning, that when we get sick, maraming gastos, di ba? But in fact, if you look at the value of early detection, when you do a screening process or executive checkup, you get to capitalize more on the good things that you could do to your body to prevent expenses related to being ill or being sick.
Now, we've been talking about the situation among Filipinos with regards to cancer and health in general. Are we comparable to the rest of the world? Pareho lang ba tayo in terms of behavior and statistics?
Yes, there's an increasing number of cancer incidents worldwide and even in the Philippines. And between male and females, it's almost equal also. It's a big problem, both economically and also both in a personal level, because it is really a big problem. Most especially because for the past 2 or 3 years during the pandemic, none of us have actually gone to the hospital for any screening.
Now, you talked about screening. Tell us the difference in this case between screening and diagnosis.
Oh, that's a very good question, because I think people would always relate to going to the hospital and doing a test as a part of a diagnostic tool. But in fact, you could go to any laboratory and go to your doctor for screen checkup. So screening is actually to find out what's not wrong with you, but what's actually well with you, so that you could actually more do of that thing to prevent disease. While diagnosis is looking for something that's wrong in the body, and most often than not, it gives you like a different kind of feeling and different kind of relationship to that kind of diagnosis.
Who would benefit mostly from this? Is it those only with a history of having cancer, or anyone, any Filipino will be able to benefit from early detection and screening?
The value of early detection is that while you're still healthy, you're able to check if you're at risk for developing cancer, maybe because of your lifestyle, maybe because your family history is very strong when it comes to cancer, or you just really want to know, while you're still healthy, if there's something that you need to probably change in your lifestyle.
Talking about lifestyle, Dr. Rex, let's remind the Filipinos, who are those most at risk for cancer?
Actually, if you're overweight, it's not just really the body mass index, but if your fat mass is more concentrated in the belly area, you are more at risk for certain types of cancer. And also those who smoke cigarettes are actually at risk also.
So a lot of factors, especially diet, maybe inactivity, low physical exercise, and genetic factors as well. Now, how important would the availability of the screening process, how would that benefit Filipinos?
At the moment, when we have symptoms or when we feel something, let's say a lump in any part of our body, that's the only time we could actually go to the hospital and do some tests. And also there are recommendations for a specific age group for some testing, such as for the breast or the colon. Now, the value of having an early screening tool is that you don't have to feel something to know whether there's already circulating tumor cells that you need to address in your body. So it gives you more time to get rid of the problem. It gives you more chances of also getting into the proper program to get rid of those issues.
Now, Dr. Rex, we've been talking about how early detection is key. It's very important, especially with regards to treatment. But why is it actually better for the person na makita na meron silang cancer or even potential to have cancer early on? How does this affect them in terms of treatment, in terms of cost?
When we detect cancer in the hospitals, when a person already has symptoms, the patient's choices would be very limited to chemo, radiation, operation, because there's nothing else that can be done except to receive treatment. But if you detect cancer early, when they're not actually spreading yet, you can actually do other things such as change your lifestyle, change your diet, lose weight, and probably increase supplementation for antioxidant, vitamins, and things like that.
Now, talking about liquid biopsy and how this is a very important tool, especially in trying to detect cancer early, can any Filipino avail of this? Or is this limited to a certain risk group, only if you've had a history of cancer? Sino bang makikinabang dito, Doc Rex?
Liquid biopsy, which we use TrueCheck for this particular testing, is dedicated to screen healthy individuals. So if you don't have symptoms, if you're still healthy, this is actually the test for you. It's also geared towards those people with strong family history of cancer and those who would like to include this test in their executive checkup every year.
Now, you talked earlier about certain lifestyle that puts people at risk for cancer. What if someone says, I eat healthy, I exercise regularly, to have that peace of mind to say, you know what, my risk of cancer is low because I'm following all these healthy lifestyles?
It's not ever an assurance because each person is different. The way genetics play and epigenetics also get into the picture is different from one person to another. Now, the value of doing a screening test is that you get to know whether your efforts are really bringing you to the kind of thing you want for your health in the next couple of years.
So that's very important for them to know as well, because knowing what cancer is definitely important, but knowing what you can do in order to prevent that, and one of that is a liquid biopsy, which we'll be talking about after the break. So stay with us here on Med Talk, Health Talk. Detecting cancer early can make a huge difference in saving people's lives. Now, to discuss about the technology called liquid biopsy, let's welcome Dr. Stefan Schuster, who is the Managing Director of Datar Cancer Genetics Europe. Hello and welcome, Stefan, to Med Talk, Health Talk. Now, let's begin by informing our public that liquid biopsy isn't actually new technology. It's been around for 20 years. But how different is the TrueCheck liquid biopsy now compared to several years ago?
Liquid biopsy was used, especially until now, in cancer patients for therapy management purposes, for monitoring the disease. What we have seen that the methods improved, sensitivity improved. In former times, 10 years ago, 5 years ago, it was mainly used in metastatic settings. Now we were able to shift this method into early stage cancers. And what we learned from there, that we can also detect those two important markers. One is so-called CTCs, circulating tumor cells, and the other one is the ctDNA, circulating tumor DNA, in very early settings. And we have focused with our method over the past few years in screening, especially for circulating tumor cells.
Before I get into the nitty-gritty of liquid biopsy, how is this compared to the traditional way here in the Philippines to diagnose cancer, which is tissue biopsy?
We have to distinguish, first of all, between screening and diagnosis. Screening, this is for patients at risk. We are looking at healthy individuals that want to know about their health, if they're healthy or not. Diagnosis, you usually already have some symptoms. Some screening appeared before, and then you are looking for a certain lump with an imaging or within a biopsy there you already know that you have to target something.
So for tissue biopsy, you actually have to have a tissue, a tumor, or something that needs to be biopsied. But with liquid biopsy, I could not feel anything at all. I could have no symptoms whatsoever, and I could take this liquid biopsy to check if I do have cancer. Now, my next question is, how accurate is liquid biopsy?
What we have found in our clinical trials with more than 50,000 patients so far, that it's very accurate. With our method, focused more on the sensitivity of the test, and we are able to find, a little bit dependent on the type of cancer, in 75% to 90% of the patients with early stage cancers, those circulating tumor cells. And then afterwards also it can be detected, for example, via imaging.
If I wanted to take a liquid biopsy, do I have to give a background? I'm looking for my risk of, let's say, prostate cancer or some other specific cancer like colon cancer, or can the test pretty much go through all the cancers and detect what's there?
You have both possibilities, because it depends also a little bit on the doctor that you are talking to, if it's a gynecologist, if it's a neurologist, or some other type of doctor. And then we can go either through only prostate, or only breast, or only colorectal, but we have also a test in our portfolio that can screen for more than 70 different solid tumors.
How do you think can this test benefit Filipinos in their everyday lives?
You can take informed decisions. You can change your lifestyle. You can detect cancer very early. If it's detected, you have a higher chance to get cured. This is what we have seen with existing screening programs already. This is the main benefit. Or on the other side, if you don't find anything, would be the case in more than 99% of the cases with our test, you know, okay, you're going into the right direction.
Talk to us about the process of the actual test, starting from me going to the clinic to have a sample taken and the time frame for me to know what this is, because sometimes a lengthy time frame can fill a healthy individual with so much anxiety.
Absolutely agreed. What we have seen in the past 1.5 to 2 years, usually you go to the doctor, it will be sent to one of our labs. This lab would be, in this case, in the UK, and after maybe 8 to 10 working days, you get your result.
Talk to us about the sample that is needed for the test and how difficult or easy is this to acquire?
It's a simple blood draw, what you have to do, and it can be done repeatedly. We would recommend to do it between 30 and 70. This is where we have validated data sets. It can be done every 12 months, just to catch fast developing tumors.
Talking to you, it seems like there's a lot of upside when it comes to liquid biopsy and how it can help early detection. So aside from the advantages, are there any limitations?
What we know from what we have seen so far, what we cannot tell you at the moment is what stage the tumor is, or if the tumor will ever become a true problem. The issue with overdiagnosis, nevertheless, this is why it's very important to manage expectations of the doctors and of the patients to know what they're getting. Nevertheless, I think we both agree that you detect a pancreatic cancer in stage 1 is much better compared to you detect it later on in stage 4.
So let's put this in practical perspectives for our viewers. If I take a liquid biopsy test and it comes back positive for cancer, what should my mindset be?
Your mindset should be definitely, okay, I want to know where is it exactly. We give you an idea about the tissue, about the organ, where it sits. Then the next step is to take an MRI, PET CT, Röntgen, whatever is available. Do I find here something, or is it all still that small that it's not found, what we have seen before? Nevertheless, I can take lifestyle changes, because we know that patients who have those circulating tumor cells have a much, much higher risk, 230 times elevated to patients that don't have those cancer cells in the blood.
That information will definitely benefit that healthy individual on how they would like to proceed later on. So we've been talking about liquid biopsy, and the good news is it is now available here in the Philippines. We'll tell you how you can avail of this test when MedTalk Health Talk returns. Prevention is always better than cure. Now, early detection and early screening can help you jumpstart in your health, especially when it comes to cancer. Now, joining us today is Chris Moore, who is the CEO of Nordic Laboratory. And we're also still joined by Dr. Rex Gloria, who is a lifespan physician. And we're also joined by Dr. Stefan Schuster, who's the Managing Director of Datar Cancer Genetics Europe. Chris, what was the main goal for Nordic Laboratories in bringing in TrueCheck liquid biopsy here in the Philippines?
If I can just go back to 1994, I meet a doctor who tells me the future of medicine is changing. It's all going to be individualized and personalized. 30 years on, we're in that zone. So what TrueCheck does is it allows the individual to be empowered with knowledge about their wellness status. We've got to shift from the fear of cancer to the embracing the wellness pact. And then doing that, we then find status, and if we find an early cancer, we can treat it quickly.
Now, Dr. Rex, how does a TrueCheck liquid biopsy help the doctor side of it, the physician, in providing the best healthcare they can for the individual?
For me personally, I've seen patients in the past, and I'm not really comfortable doing tests when they're already sick or they have symptoms. So now it increases my comfort level to screen for something that I, in my facility or capacity, be able to help them prevent more problems.
And Dr. Schuster, how do you think can this test impact the current way that cancer is treated here in the Philippines?
We see our tests not as a replacement for standard of care tests. That's absolutely clear. We see them as an add-on for high-risk patients, for patients that want to know more about what is going on in their body to take informed decisions, basically.
Now, Chris, the most important question is, how can the Filipinos avail of this test?
Well, one of the most important things with any lab test at all is logistics. So making sure we get the sample to the laboratory in a timely fashion. These tests are very special, and they have required immense amounts of research and development, and there are only few facilities in the world that can do it. So we will ship these samples from the Philippines to our UK lab, and that requires speedy transportation, efficient monitoring across the world, and making sure those samples reach the lab in the right time. Our job at Nordic Laboratories is to inform as many physicians and hospital centres about this technology. So we will help to inform the doctors, educate the doctors, and then patients will be able to ask their own physician, can I do this test? If they can't, they can find lifespan doctors like Dr. Rex who will be able to help them.
Now, what if someone has a test done and it comes back negative? What does that mean for them? Can they have that peace of mind?
If I take on a personal perspective here, I'm 52, I do my TrueCheck test and it comes back negative. Should I be up cheering? Maybe. I feel pretty good. But it empowers me to say, okay, the things that I'm doing in my life appear to be preventative. That's great. What else can I do? Are there other things? And the future of medicine is all going to be around performance and longitudinal data. So the more information we get to plug in about how we perform, we're going to change more and more of our lifestyle.
Basically, Chris, what could you say about who is this test for? How can this benefit them? And how can this change the current landscape of cancer detection or preventive detection for that matter?
First of all, we're going to see a shift away from being in fear of cancer. This is an empowerment tool. So we're going to be able to have a status point of wellness. That's the first key. Who is at risk? Family histories, maybe people are a little bit worried of certain cancers. Okay, let's do an early screen. But it's actually available for everybody. It's saying, I can take control of my health when I'm well. And that's going to be the game changer. Everybody from the age of 30 or upwards. And then I would do annual screens as part of my overall strategy of monitoring my wellness.
Definitely, we learned a lot today, and thank you to Nordic for bringing in TrueCheck liquid biopsy here in the Philippines. But before I let you guys go, do you have any message for our viewers?
It's a beautiful test to do for healthy individuals because rather than we focus on finding out what's wrong in our body when we go for a test, we are now having something that could actually measure what's right in our body. And we could continue doing that health and preventive aspect of our life. And for physicians, it's also like adding confidence level to the kind of screening parameters that we are offering to the patient.
We have plenty of tests, plenty of clinical trials, plenty of experience that you can get a comprehensive overview in real time about what is going on in a cancer patient. And now we are adapting this concept to non-cancer patients, to healthy individuals. And this is a way to move forward, to get informed decisions, to have an overview about what is going on in your body.
TrueCheck is an empowerment tool. Imagine being told from a blood test that you have a minimal chance of having cancer, you're well. Imagine telling your family. The importance of our own health in contributing to society's wellness is immense. So we all have a responsibility. And if we can use these tools to create a society that isn't going to the doctor because of disease, but they're going to say, how can I perform better, then surely we're on the right path.
And with that, thank you so much, Chris Moore, for joining us today, Dr. Rex, and of course, Dr. Stefan, for joining us and sharing this information with the Filipino people. Information from early detection and screening are powerful tools to help us take control of our health. I'm Dr. Freddy Gomez, and thank you for joining us here on MedTalk Health Talk.